Welcome to On the Beat. Today I am joined by doctors from Gastroenterology Associates of Columbus and Starkville, and sitting with me is Dr. Ricky Johnston and also Dr. William Gillespie. And so we're going to talk about a subject that I was telling somebody before I came in today, nobody wants to talk about. It's like, I have hemorrhoids. No. And so can you tell us what is a hemorrhoid?
Yeah, and to your point, before we dive into that, we have people who come in all the time for other reasons. And through our examination or discussion with them, eventually we'll tease out, well, by the way, I've been having hemorrhoid problems for a long time, and people are hesitant to talk about it for a lot of different reasons. So,
yeah.
But yeah, hemorrhoids are basically just little veins down in the lower part of the rectum, just inside the anus there. And you know, everybody's born with hemorrhoids to a degree, and everybody has that as part of their anatomy. And when we think conventionally of hemorrhoids, it's when those get a little bit swollen and engorged with blood for various reasons and start to cause symptoms, and that's when people think they have hemorrhoids.
And then what are those symptoms?
Typically, the main symptom a lot of people will notice, you can get bleeding if you have big internal hemorrhoids. They can cause itching, they can cause pain, and they can cause, sometimes can affect the way you have bowel movements, make it a little more difficult to have a bowel movement. And if they get really big on the inside, then you can get external hemorrhoids. So a lot of people have internal hemorrhoids and don't even realize it because you can't see them or feel them, but they can still cause problems.
So it can be internal or external.
Yeah, important to mention that because a lot of times we find hemorrhoids on a colonoscopy, and then people are like, oh, I didn't even know I had hemorrhoids. Well, we see it during the colonoscopy and note that. One other thing to mention along with those symptoms is people can get, and this is not a topic they like to talk about either, but like soiling or leakage. Mm-hmm. Sometimes people can, the hemorrhoids almost act as like a little wick, and so you can get a little bit of mucousy discharge in that area from hemorrhoids, and that's something we can potentially treat as well.
And what would be the treatment for either those people that have had the colonoscopy and you say, by the way, did you know you had hemorrhoids, or you're experiencing the symptoms?
Mm-hmm. Conventionally, we've recommended, or historically, just conservative management, and then as a final insult, I guess, you could refer somebody to a surgeon for a hemorrhoidectomy, which is a kind of it's an operation that has some side effects and risks and complications, and so surgeons have never been really excited about doing those in a lot of cases because people just have not had great outcomes. And so there's some stuff that we're doing in our world now that has been very effective. We had been doing hemorrhoid banding for a while, which we've talked about on the show before, and now we're getting into this HemWell procedure, which we have mentioned on a previous broadcast, but now we actually have some first world experience with it where we've been doing it now for a few months and have been find that it's effective as well.
And you're pleased with the response and patients? What are patients saying about it?
Really haven't heard anything negative back from any of the patients we've done it on. It's kind of a procedure. It's we're one and done. Come in, takes about 20-30 minutes, and so far everybody has had pretty good results and not any complications.
Yeah. It does require another procedure, so people will be put to sleep again, and we can explain that more if people come for it, but while they're asleep, we take a little device that applies an electrical current and causes the hemorrhoids to clot off, and it's generally very well tolerated.
And there's no burning or cutting or anything, so the recovery is pretty easy. There's not a whole lot of side effects after we're done.
Good to know, and common, and so nobody should be afraid about coming to see you for it. But if anybody has questions, just check the website at the bottom of the screen, and that's today's On the Beat.